Barb Blacklock and I, Michelle Trotter-Matheson, are the co-chairs of the Provost Committee on Student Mental Health, and we'd like to provide a brief overview of the broad range of mental health initiatives that have been implemented on the University of Minnesota Twin Cities campus over the past 10 years. These initiatives span categories including education, training, outreach, clinical services, and more, and involve a variety of components of university life. The Provost Committee on Student Mental Health is composed of 23 university members representing diverse academic and administrative units and student organizations. The committee's charge was initiated by E. Thomas Sullivan and has been reviewed and reconfirmed by Provost Karen Hansen. We take a public health approach to mental health. Faculty and staff contribute to all of these goals. Information.
Our goal has been to make mental health information accessible online, when distressful situations happen, on mobile devices, and at strategic campus locations. Assessment.
Individual screening tools are available on the mental health website. University-wide surveys are completed to better understand student well-being. Services.
We have a variety of campus resources to include counseling, clinical psychiatric services, expanded services on the St. Paul campus, disability resources, services and supports for victims of sexual assault and relationship violence, psychological support and services for student athletes, support for faculty and staff when they have significant concerns about student behavior, supportive services for groups of students impacted by trauma, stress reduction resources available through the Center for Spirituality and Healing, access to therapy animals at various locations on campus, including a therapy chicken, Woodstock, yoga classes, free or for credit, 1-credit classes on applicable public health topics, and enrollment in an online stress study. Events.
Several events related to supporting student mental health and raising awareness occur on our campus each year, including Mental Health Awareness Day, Respect You, Cirque de Stress, and various art exhibits. Campaigns.
To maintain awareness of the mental health website, to reduce stigma and increase awareness, to provide students with tools to be effective, active bystanders. Grants.
A number of grants have been secured to assess needs and develop programming related to student mental health, including 2 American College Health Foundation grants, a grant awarded to the Disability Resource Center that provided the seeds for the development of the Provost Committee, a grant to explore the barriers for medical trainees with invisible disabilities. Policy.
Development of a mental health syllabus statement endorsed by the Senate Committee on Educational Policy. The Provost Committee on Student Mental Health worked to change policy to include bereavement as a legitimate reason for student absence. Training.
A number of trainings have been developed for faculty and staff, online interactive trainings for students, faculty, and staff, for parents. Academy of Distinguished Teachers hosted a fall retreat on student mental health, and a training by campus police. Students.
A variety of student organizations with faculty advisors are committed to reducing stigma about mental illness. Community collaboration.
Our community collaborators include the Veterans Administration and Minnesota NAMI. Outreach.
We share best practices at national conferences and with professional organizations. Research.
Research is regularly being conducted around mental health-related topics. Opportunities.
New ideas and opportunities include providing support to students through other mediums such as text messaging and peer-to-peer support. This overview was to provide you with a broad sampling of some of the significant mental health initiatives that have been accomplished on the University of Minnesota Twin Cities campus. We invite you to keep up to date on current initiatives by visiting the website www.mentalhealth.umn.edu. Thank you.